on Instagram. We are live on TikTok, and we're now live on YouTube. Cool. So we got all the places. So I'll be going off some notes over here on YouTube. So I might be looking this way, not necessarily YouTube, but my camera or my computer. So what I wanted to talk today about was I've kind of been giving outlines on my Instagram. I've kind of been giving outlines of like, I threw up a concussion pyramid. I threw a little carousel of like, here's what you should know, just kind of big picture what you should know about concussion, concussion management, diagnosis, what you should be checking, kind of a checklist to make sure your doctor is doing the bare minimum, and then some. And then some for a lot of conventionally trained doctors would be diet, would be supplementation. And so within that pyramid, I talk about sleep is kind of the foundation. If you're not getting quality sleep, nothing's going to kind of come together for you. And then after that, we've got nutrition, movement, mindset. On top of that, we've got subsymptom threshold exercise, visual vestibular therapy, cervical spine therapy, sort of the functional rehab, neurology, that sort of thing. And then on the very tippy top of the pyramid, you've got kind of the extra therapies, cold laser, PEMF, HBOT, things like that. So within that pyramid, I consider nutrition to be super, super foundational because nutrition is the main driver of all the metabolic. One way to think about it is, I read this awesome published years and years ago. What are your 4 pounds made of? And what they're asking is, what are your 4 pounds made of? Because the average person, like the average food secure person, I understand that there are people that live in food deserts or are not necessarily food secure. There's millions of Americans and children that go to bed hungry every night. But in the food secure population, the average person eats 3 to 4 pounds of food a day. So that's a lot of food. So what are your 3 to 4 pounds made of? Is it driving inflammation or is it driving recovery? Is it are your 4 pounds working for you? And so in concussion rehab, we can think about the same thing. Like, what are your 4 pounds made of? Are your 4 pounds helping or hurting your concussion recovery? And we're going to kind of build a case for diet here. So hopefully in the next 15 to 30 minutes, you'll know kind of how to be eating for recovery. So with that, before we talk about specific diets, I'm going to kind of build a case because there is no diet for concussion. You can't Google the concussion diet. You can Google the DASH diet. The DASH diet is for like cardiovascular disease, kidney disease. You can look up ketogenic diet. Was actually originally for not treatable epilepsy. So people who are having seizure disorder that wasn't being treated by medications, possibly certain cancers for ketogenic. We've got the Mediterranean diet for cardiovascular disease. So we've got these diets for diseases, but there's nothing necessarily for concussion or for TBI. So how do we make sense of what food might actually be beneficial in concussion? And we kind of got to go back to like what is happening in the brain. You've got this impact, whether to the head, to the neck, to the body, that transmits force up to the brain. Your brain kind of shakes and jostles. It's mostly fat, so it's kind of wiggly, and it stretches. And it doesn't tear. If it tore, we would see something on imaging. It would no longer be a concussion. It would probably be a moderate or severe TBI. You would be a lot worse off because you just tore and severed some pathways in your brain. So you get this functional stretching and shearing, and electrolytes go everywhere because you stretch and you open up these channels. And so calcium in particular is one we're looking at, but sodium, potassium, chloride, magnesium, stuff is going everywhere. And the calcium is causing this excitotoxicity because when you stretch and you release calcium, calcium's excitatory. And so it causes this release of glutamate, which is excitatory. So glutamate causes the release of more calcium and all yada, yada, yada. So you're excitotoxic, you're kind of dazed. That's what's happening when you kind of feel disoriented or you actually lose consciousness. That kind of like stumbly, the Patrick Mahomes stumbling as he got up, he was having this excitotoxic soup going on through his brain. And after that happens, you've got to get everything back. You've got to put all those electrolytes back. So there's all these channels and stuff going on in your brain, trying to shove everything back, and that causes this massive energy deficit. So for the first 3 to 5 days after a concussion, your energy levels dip and your symptoms typically peak. So people feel their worst 3 to 5 days after concussion, and their energy levels are dipping. And then within 7 to 10 days, they feel better. And 21 to 30 days later, energy levels should be restored. But what are we doing? What can we do with food to minimize that energy deficit? And to promote a faster recovery, we can leverage those 3 to 4 pounds. So going through some notes here, I think I covered all that. Yeah, so basically what we're looking at is when we look at concussion, there's 3 kind of big metabolic, I kind of break it into 3 problems that I try to address with supplementation or with nutrition. So you got this neuronal stretching and shearing, you got this brain stretching and shearing. So you want to promote the normal and healthy integrity of neurons before injury, but also after injury. You want to mitigate the damage of that stretching. So you want to provide substrate and molecules for that structural recovery to make sure that the foundation is solid. From the excitotoxicity and kind of like electrolyte imbalance, you want to minimize that excitotoxicity and inflammation. You want to provide easy energy because you're having to put all this stuff back, but calcium has actually flooded your mitochondria. So it flooded the powerhouse of the cell, and that powerhouse of the cell can no longer make power. So it can't do it aerobically anyway. It can't use oxygen as efficiently. So your cells get about 9 times less efficient because they're going to anaerobic power. So how do you provide easy energy? You can do that with different dietary strategies. And then we want to regulate that inflammation. From a blood flow standpoint, again, you've got this, I don't think I mentioned it in this video, but when you got the decreased energy, part of it is because you've got this autonomic twisting of the brainstem. Again, you didn't tear anything, but you shifted autonomic. So you went a little more, most concussion patients go way more sympathetic, have a harder time turning on parasympathetic. So their foot's on the gas and they have trouble hitting the brakes and kind of taking off the gas. So again, one thing we can do is provide easy energy and possibly do things to promote cerebral blood flow. So what does that look like? It sounds really fancy, but really it comes down to, this is probably going to be the most anticlimactic live session. It comes down to eating lots of fruits and veggies, lean proteins, healthy fats, smart carbohydrates, so less processed foods, no alcohol, and staying adequately hydrated. So really it looks a lot like a Mediterranean diet. And then possibly some people can do well with a ketogenic type diet. And I'll talk about that in a second. One of the other things we got to consider before I jump into food is we got to consider the gut-brain axis. So that is literally what it sounds like. It is the axis. It is the connection between your gut and your brain. So you've got your enteric nervous system, your central nervous system, and it's connected via the vagus nerve. It's connected via your microbiome, so your flora, and those floral metabolites and gut hormones. So you can literally have this direct highway of the vagus nerve, but then you've got these indirect pathways. So your gut microbiome is regulating these hormones and these metabolites that then circulate up to the brain. And you've got this two-way street. So you've got this central inflammation happening in the brain, and you've got this peripheral kind of systemic inflammation. And one of the things you want to leverage with diet, especially really early, is you don't want this systemic inflammation to perpetuate and kind of keep this cycle going in sort of this positive feedback loop. So one of the things we can do is sort of leverage what we're putting into our gut to minimize inflammation here, so that we minimize inflammation here. One fancy little tidbit is we talk about in concussion within 3, 6, 8 hours, the research varies, but it's somewhere between 6 and 8 hours after a concussion, your blood-brain barrier starts to get leaky. So these little astrocytes, these cells that kind of create a barrier around the vessels and around the brain, they start to kind of like leak, right? So stuff can get into the brain. So inflammatory stuff can get into the brain easier. Well, within 6 to 8 hours, the gut also gets leaky. And what I'm finding is there's some research that says we should not be calling it leaky gut. And it's not that your gut actually gets leaky and bacteria and stuff is actually getting into the system. It's that the immune patches within the gut actually might upregulate their processes. They might upregulate bacterial grabbing and stuff rather than bacteria actually translocating paracellularly, actually kind of passing through the cells to get into the gut. A little side with that, lipopolysaccharide is a huge player in the gut kind of pathology world, because bad bacteria will have lipopolysaccharide, and the gram-negative lipopolysaccharide. And lipopolysaccharide is really inflammatory. You can measure LPS levels. You can measure it in the blood. You can measure it in the gut. But LPS is this pro-inflammatory thing. If LPS triggers the microglia, triggers the immune cell within the brain, one exposure can lead to inflammation for 10 months. So one LPS exposure from the gut can lead to microglial inflammation and kind of priming for the next 10 months. So that's why we want to quell this inflammation in the gut. One of the arguments against leaky gut is that within my gut, within your gut, whoever's watching this, you got enough. If you took all the lipopolysaccharide from all the bacteria in your gut, you have about a gram, I believe. I'll post this study later, but you got about a gram of lipopolysaccharide in your gut. That gram of lipopolysaccharide, if we were to inject it in people, could literally kill hundreds, if not thousands of people. So you've got enough poison in your gut, lipopolysaccharide in your gut, to kill hundreds of thousands of people. If your gut was actually leaking, you'd be dead. You'd be looking at systemic failure, sepsis. So the gut doesn't necessarily leak, but we do see an increased inflammatory response after concussion. So what can we do? The punchline: Mediterranean-ish diet, ketogenic-ish diet. There's three kind of diets that, again, there's not like concussion diet, but there's three kind of diets that make sense. It's the Mediterranean diet, paleo, and keto. And the common theme between these diets is they all promote real whole foods. They don't allow for much refined processed sugars and carbohydrates. There's an emphasized intake of healthy fats. Again, your brain is mostly fat. And they emphasize an intake of like leafy, colorful vegetables. Even if it's ketogenic, even if you're eating a ketogenic diet, half of your plate should still be these non-starchy, deep colored vegetables. So with that, the diet is very anticlimactic. It's as much whole foods as you can. It's not really hacky. You can't biohack your way. I hate the term hacking. I don't like biohacking. It's kind of, I'd rather you work with your physiology than try to trick your physiology, because you can't. I posted in my story, and then Will the Wallace posted a picture of like human metabolism. This is like a really dumbed down version of human metabolism. This is really, really, really simple. It doesn't include even half of anything. And if we think we can regulate that and like hack that, we're kidding ourselves. So the big picture is try to eat as much real whole food as you can. Try to eat lots of colorful fruits and veggies. Emphasize an intake of healthy fats, and emphasize less processed carbs. So evidence for, I guess, a push for the Mediterranean diet would be that, where do I got it? So you're looking at fruit, veggies, and grains. You're looking at micronutrients. You're looking at prebiotic, probiotic, fibers, healthy fats, and fish intake. You're looking at an increase in omega-3s, EPA, DHA, kind of modulating the inflammation, but as well as providing structural support for your neurons, for your integrity of your brain cells. The increased fiber intake positively impacting the microbiome, lean proteins, providing the substrate for enzymes, for proteins, for neurotransmitters. Again, with the Mediterranean diet, we're really trying to lower the inflammatory load. One of the other things that if you're eating a relatively standard American or standard Western diet, moving to a Mediterranean diet and eating more fruits and veggies than you otherwise would have, especially more vegetables, eating more veggies than you otherwise would have, creates a relative caloric deficit. And what that means is you've got, relative to what you had been eating, you're now eating less calories, but probably more food. You probably feel more full when you eat more real foods. But that caloric deficit actually provides a little bit of a benefit. We find that when we drop weights on rats' heads and give them concussions, the rats that have caloric deficits, so the mice that don't eat as much food, recover faster. And so there might be a benefit to this fasting mechanism. So that brings us to ketogenic and paleo. There's some good research in severe and moderate TBI, so much worse than a concussion, much more significant, much more life-threatening than a concussion, using ketogenic diet. And the idea is that ketones upregulate ATP production. They promote mitochondrial function and production. It can mitigate neuronal death and kind of promote neuroplasticity. So everyone's like, oh, we should do ketogenic. And yeah, it's super cool. I think it's awesome if you can pull it off. But for most people, it's not a sustainable long-term solution. You can see some people don't pull it off well. You'll see cardiometabolic profiles get worse. So lipids and things going up. You've got to be able to do it right. So where we kind of meet in the middle is that intermittent fasting, you still, after 8 to 12 hours, will get some ketosis. So you'll still get this ketogenic effect. You'll get the caloric deficit effect, but you can still eat this relatively simple, kind of healthy Mediterranean-ish diet where you're just trying to get fruits, veggies, healthy carbs, healthy fats, lean proteins, minimizing the processed carbs, not drinking alcohol. We haven't talked about beverages yet, but not drinking alcohol, contrary to the Mediterranean, drink a glass of wine. So this healthy, otherwise healthy diet that can be pretty easy to adopt by most people from most cultures, whether you're vegan, carnivore, whether you're like my wife is Indian, I'm just a white dude born in Wisconsin. So like you can make the Mediterranean diet work kind of wherever you're from. And if you want the ketosis benefits, if you want the ketogenic benefits, take a 12 to 14 hour overnight fast. So sleep through your fast. But if you stop eating at 8 p.m., don't eat again until 8 a.m. And so you get this 12-hour fast right around 8 to 12 hours in that window from 8 hours to 12 hours. Your body is probably upregulated ketone production. We can assume that it has. You can actually get ketone strips and test yourself. But you get this benefit of the ketosis. So you get this benefit of the ketogenic fasting benefits of improved mitochondrial function, improved plasticity, some of the autophagy benefits where you're actually clearing crap from your body when you're in this caloric deficit. But you don't have to do this crazy socially restrictive diet, the ketogenic diet. Again, I'm not poo-pooing it. If you've lost weight on it, if you feel better on it, if you're mentally clear on it, awesome. If you can pull it off, awesome. Most people can't. Most people can't do it well. We'll see their labs go off. We'll see their mood go off. We'll see it's more socially restrictive than it is healthy. Your social health is actually really, really important, as we've seen in 2020 into 2021. So the diet that I'll recommend is Mediterranean. Half of your plate should be fruits and veggies, at least a palm of protein with each meal. I'll say 2 fists of veggies. So that's about half a plate, a palm of protein. If you're going to have smart carbs, it'd be quinoa, rice, whole grains, things like that. It would be a scooped hand. So that would be 1 to 2 scooped hands per meal. And then thumb represents fat. So this would be about the portion of fat. If you're using oils, it would be about a tablespoon. So 1 to 2 tablespoons, 1 to 2 thumbs, 1 to 2 cupped hands of carbs. So 1 to 2 thumbs of fat, 1 to 2 cupped hands of carbs, 1 to 2 palms of protein, and 2 fists of veggies. It's not negotiable 1 or 2, it's 2 fists of veggies. And that's going to give you ample food. That's definitely 3 to 4 pounds of food a day. But if you're eating a standard American diet, there's a relative caloric deficit. You're getting way more nutrition. You're supporting the gut. It's likely anti-inflammatory. And with that, we see better improvements in TBI, especially in animal studies. So with that, let's talk beverages quick. Water, like water. People who tell me they don't like water, I'm like, dude, imagine your dog or your cat like refusing water. Like, you're an animal, you drink water, you are mostly water. People who don't like water, it drives me nuts. I'm like, you're fucking human, you're an animal, drink water. So this is about 40 ounces. My weight, I need to drink about 2 of these a day minimum. So the way we'll calculate that is, if you're watching from America, I know I've got a recent flux of people from the Netherlands, but if you're watching in America, take your body weight in pounds. So I fluctuate between like 155, 160. So I just say 160 for water purposes. Divide your weight in half. That's how many ounces at a minimum you want. We typically tell people 2 to 3 liters of water a day. So if your body weight is notably less than that 2 liter mark, you're drinking 2 liters. So for me, this ends up being about 80 ounces. I can't convert that in my head because I grew up in America. So for the rest of folks watching in countries like everywhere else in the world that uses the metric system, take your body weight, so kilograms, take your body weight and multiply it by 3 to 4. So you're drinking 3 to 4 milliliters per kilogram of body weight. And again, dividing your body weight in half by ounces or timesing it by 3 or 4 in kilograms to get milliliters, it ends up being roughly the same range, which puts most people at 2 to 3 liters of water per day. But if you want to get specific with it, that's how you're drinking. Why do we do this? We've taken healthy people, we've dehydrated them, and we've tested them with like concussion tests and symptom questionnaires. healthy people, non-concussed people that get dehydrated feel concussed and they perform concussed. We don't like being dehydrated as humans. You lose 0.5% of your body water and you start to see an increased strain on the heart. You lose more than that, you start to lose aerobic performance, cognitive performance. So you want to be hydrated, drink water. The other awesome drink that I really like in concussion, and I posted about it on Instagram recently, is green tea. The EGCG has awesome like neuroprotective effects. It's antioxidant, it's anti-inflammatory. So that's kind of that. Alcohol. There's 3 things that will restrict after concussion. Kind of speeding it up here because I don't want it to go too long. 3 things that kind of restrict after concussion. 1 is alcohol. You shouldn't be drinking more than 1 to 2 drinks per night anyway. That's considered like standard moderate drinking. More and more research is showing that no amount of alcohol is particularly healthy, despite the red wine having antioxidants. There's other ways. Just eat the grapes. You don't necessarily need the wine. Again, social drinking, I understand it, but try to limit it to 1 to 2 drinks a night. I'll have people ask me, well, 1 to 2 drinks a night, that's 5 to 10 drinks a week. Can I just do that in one day? Absolutely not. That is considered binge drinking. So if you drink more than 4 to 5 drinks, men or female, 4 to 5 drinks in less than, like in a short period of time, 4 to 5 drinks in like less than a couple hours, it's considered binge drinking. We see increased risks of stroke, of different cancers, of different cardiovascular conditions. No amount of alcohol is cool. I mean, when I say cool, I mean from a health perspective, it might be cool socially. I definitely will have a beer with people. There's like, I love a good burger and a beer. It's awesome. But again, cut it off at that 1. You don't necessarily need more. Especially after concussion, we see alcohol disrupts the gut flora, and we've already got a disrupted gut-brain axis. I know that even if I stop at 1, my watch tracks heart rate variability and sleep scores. 1 drink, even if I don't feel anything, I'm like, it's whatever, I just had 1. My heart rate variability for the night tanks, my sleep scores tank, and so my recovery for that night is shot. I know if I'm having an alcoholic drink that my recovery for the next day is shot. And we don't want that in concussion. So no alcohol for aggressively. If you like need to drink, no alcohol for the 2 weeks after a concussion. We also will throw in no gluten and no dairy. And the reason we throw those in, and I'll talk about this in a second because I said I would talk about tests. The reason we throw no gluten and no dairy in is because we've got more and more research showing that gluten just kind of, it triggers the gut. It might just be here in America. It might not be in, like, I know I was able to tolerate dairy in Italy a couple of years ago. That was cool. But we know that the gliadin, gluten proteins kind of inflame the gut a little bit. We extrapolate that through increased zonulin levels, this protein in the blood. And we basically assume that the gut's getting leaky. But again, we know that it's not leaking. So what's happening, we don't know. We just assume there's this inflammatory response to gluten. And most people can't tolerate dairy. Most people lose the ability to tolerate dairy after around 4 years old, especially white folks. I think it's like 70% of white folks can't tolerate dairy very well in terms of lactose intolerance. But dairy and gluten are these 2 things that can be inflammatory in folks. And I don't think I've had one person except maybe my brother who hasn't cut out dairy. And when they reintroduced it, we're like, oh, you know what? I feel like crap when I eat dairy. I'm kind of slower, I'm foggier, my gut feels this way, I get headaches, something doesn't sit right with them. My brother has a gut of steel. I don't know, that's cool, I'm jealous. So the 3 things: no alcohol, no gluten, no dairy. And the reason, again, for those, largely inflammatory, largely trying to mitigate the potential for systemic perpetuation of this gut-brain axis inflammation. So you're post-concussion. A lot of people watching this are post-concussion. You've had concussion for 3 months, 6 months, 6 years. Your first concussion was years ago and you're like, dude, I'm not in that 2-week window anymore. One of the tests I'll do for folks in terms of diet is, say you've been eating Mediterranean, say you've been eating really healthy. You've been doing the things and you don't notice anything. Like, how do we continue to leverage that 3 to 4 pounds of food every day? Imagine taking 3 to 4 pounds of a supplement. That'd be insane. So food is very powerful. It's a powerful driver. One of the tests I'll use that I've posted about, I think I've got individual videos and posts on IgG testing. Very controversial. Some folks are super anti, some folks are super pro. The only folks that I've seen against this are actually like paid industry funded studies. So I haven't seen any like really good independent studies that have anything against this. This is one of the few tests that they really have to like refute the evidence. There's other tests like muscle testing and things like that where they're like, no, we just that doesn't make sense. They really have to fight to make this one seem like a bad option. And I agree with some of the arguments. So some of the arguments are, well, we're supposed to produce IgG. IgG is this it's this antibody, and our immune system is designed to tell self versus non-self. Is that food me or is it not me? And food is not me, so I should have an immune response to it, right? So what they're saying is, well, yeah, you should produce IgG to foods. Therefore, it's not valid. But what we're seeing is that, again, here's a sample test. So this is no one's individual test. What you'll see is as we get red, it's kind of more antibody, more inflammatory response, more of an immune response to food. What you'll see is the whole thing isn't lighting up like a Christmas tree. It's just kind of a couple foods here and there, a couple foods here and there, a couple foods here and there. Just got to talk to all the cameras. And what I like about this is if we see an overt, like you don't produce any IgG across the board, I'm going to assume an immune deficiency, and I'm going to test serum total IgG. I want to see if you're even producing antibodies because you might be an immune deficient individual. If you are just lit up across the board, yeah, I'm probably not going to have you exclude all of these foods. I'm not going to have you do a restrictive diet. I'm going to probably work you up for like IBD or some gross, and not gross as in disgusting, but like gross as in big inflammatory bowel disorder. But when you see here, like individual specific foods, this sample person is responding to kiwi, green grapes, and bananas in terms of fruits. And so those are foods that otherwise would show up on a Mediterranean diet. But for this imaginary individual, they're having an elevated IgG, an elevated immunoglobulin G response to this food that is causing this kind of slow, smoldering inflammation. So it might be the joint pain, the headaches, the brain fog, and the insomnia that you can't really tie to anything specific because you eat this food over the next hour to few days, IgG is rising, but you can't, it's not like an IgE reaction. It's not like a peanut allergy. It's not like something acute. So you eat it 3 days later, you eat it again, you eat it again, you eat it again, and this inflammation just stays up, but you can't tie it to anything. So we throw in a test like this, we throw in an IgG test, and we go, oh, hey, cool, look. For me in particular, I can't do whey, casein, dairy, cow's milk. Dairy is just off the table. Almonds, cashews, and lentils. So those are kind of random health foods that I can't do. So I cut out almond milk. I cut out almonds. I just haven't been eating dairy since like 2013. And these different foods, and lo and behold, my sleep gets deeper. Lo and behold, I don't have actually seasonal allergies really anymore since getting those foods out. So we took away this inflammatory load, giving the gut some time to heal so that now in terms of your post-concussion progress, in terms of you've had these symptoms for years, let's take away this inflammatory load, give the gut a break, give the brain a break in terms of this inflammatory process. Let's hit your rehab from these other angles. I'll be talking about supplements next week, but hopefully this all kind of made sense. It was, I know it was kind of rambling and kind of piecemealed together, but the big picture is that our diet really, 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 really matters. I know there's a lot of doctors out there that still don't talk about food with patients. It is insane to me that you are literally made up of the food that you eat. You are what you eat because you eat protein, and that protein gets assimilated into you beyond macronutrients. So beyond your broy macros, beyond proteins, carbs, fats, you've also got phytonutrients. You've got vitamins and minerals and micronutrients. And those all matter. Like your enzymes don't work without organic and inorganic cofactors. And those organic and inorganic cofactors are vitamins and minerals. We can regulate inflammatory processes with phytonutrients, anthocyanins, and flavonoids and berries do wonderful things. So let's use those. Let's leverage those. So in terms of concussion, what that looks like is let's eat as many fruits and veggies as we can. Let's stack the fibers and the phytonutrients and the vitamins and the minerals. Let's provide healthy fats. Let's provide avocados, nuts, seeds, oils, healthy oils. We're not using like canola oil. We're looking at like avocado oil, fish oil, flax oil, coconut oil, things like that. Healthy fats to provide substrate and some inflammatory regulation, bias towards the omega-3s. And let's provide lean proteins because you need protein. Your body is mostly protein and minerals and fat. You don't really have carbs in your body per se. There's carb cell signaling molecules and it's used for hormones and stuff. But like structurally, you are just like a boatload of fat, protein, and minerals. And so you need those. So let's leverage that. Let's have half our plate fruits and veggies. Let's have a palm of lean protein. Let's have 2 thumbs of fat. And let's do that consistently. And let's see how that regulates inflammatory processes. Let's minimize alcohol intake. Let's optimize water intake. Let's make water human again. Let's not it doesn't have to have a flavor. It's water. Nothing better than a good glass of water. Gluten and dairy acutely, let's cut it out. If you're in the chronic stage, it might be useful to have a test like an IgG test. Again, we talked about the pros and cons of that a second ago, but IgG tests can be useful for finding specific little foods. Eliminate those foods for 4 to 6 weeks. See how you feel. Gradually reintroduce those foods. We don't want to cut out foods forever, but if they're having an inflammatory response, let's see if that's something you can remove and then tolerate later. For me, dairy is just out of the question. Send me love because that sucks. I miss pizza. Yeah, so big picture, that's cool. For folks interested in the ketogenic diet, I typically reserve that for more severe concussions, severe TBI, moderate TBI, people who lost consciousness for close to an hour, people who are really kind of struggling. Moderate, severe TBI, you're looking at, they're a little more life-threatening than concussion. Concussion sort of just becomes life-threatening when you're at risk of repeat concussions. So ketogenic I reserve for more severe cases. If you want to get some of the benefits of ketosis, of the ketogenic component, do your Mediterranean diet, but add a small intermittent fast. So again, talk with your doctor before any of this. I'm not recommending that you jump into fasting. There's some people, type 1 diabetics, there's folks that should not be fasting without supervision, maybe not fasting at all. So Mediterranean diet, 12 to 14 hour fast. So stop eating at 8 p.m. Don't eat again until 8 a.m., 10 a.m. to get that 12 to 14 hours. At around 8 to 12 hours, you're going to get that upregulation in ketosis. That's going to have the mitochondrial, neuroplastic, autophagy benefits. But you still got to eat mostly simple, healthy, kind of what you would picture to be a healthy plate. And that's kind of how you leverage diet. Really, it was a long, rambly way to get there. But that's how we leverage diet. We'll be talking about supplementation next week because I know I had posted my pyramid and cover 3, this awesome supplement. It's super tasty. They had asked me how I look at nutrition, where I rank specific supplements. And so I will be talking about supplementation in the acute and chronic phases next week. And we'll talk, I do make money off of cover 3. Not a ton, but when I sell a supplement, I get a small percentage of it. And so I'll talk about them, but I'll actually say some things that they might not be happy about. So I'll give you the honest opinion of where cover 3 fits into the picture, where I put other supplements into the picture. We'll talk about how we can kind of leverage supplements a little bit more for specific symptom management, because there are no FDA approved drugs for concussion or for neuroprotection really. So where can we leverage our food and where can we kind of bolster that food with supplementation? But remember, food is the foundation. You can't out supplement a shitty diet. So food is the foundation, and then we're going to throw in little super physiologic doses of things here and there to try to push metabolism in a certain direction. Again, we can't micromanage metabolism, but we can push it in a certain direction to minimize symptoms a little bit, or to kind of produce an effect that we want during rehab, so that we can then pull that supplement away and you can live your life. So supplements shouldn't be a forever thing, but we'll talk more about that next week. So hopefully that was coherent. Thank you. We reached 34 minutes. So with that, I will see you guys.